She looked like a striped bass. That's the picture she sent me. She's one of our very favorite patients.
I was a little skeptical when I saw the photos.
We're the only office in the area that has it.
And it won the 2022 New Aesthetic Device.
I love the fact now that we get asked if our photos are photoshopped. Hi everyone, welcome back to Beauty and the Brain, the podcast that talks about all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm Jerry Drinkard, family nurse practitioner, and we're so excited today to be joined by a special guest that we've had on previous episodes, Miss Allie Ballou. Allie, would you like to introduce yourself?
Yeah, so I'm Allie. I'm one of the nurse practitioners at Skin and Tonic, and I'm super happy to be back. I hope you guys enjoyed our first few episodes, and I'm excited to do it again.
Yeah. Thank you so much for coming back and joining us. I know that you're going to be here frequently sharing all of your knowledge with our listeners, and they appreciate that as much as we do. Today we have a super, super exciting topic, and we're trying to start each episode with questions that are submitted from our viewers and pick topics and answer questions, that they kind of submit and want to know to us. So one of the things that I think all of us get asked commonly is, what is our favorite laser treatment? So we have a lot of devices in the office. We have a lot of, we say lasers, but they're really more energy-based devices. Some are laser, some are radio frequency ultrasound. But when we get asked what is our favorite, one of the things that we all love the results of and we love to perform is our NeoGen PSR. And so that's what we're going to be talking about today. This whole episode is going to be on nothing but the NeoGen, what this device is, how it works, the wonderful results we get from it, the skin conditions it treats, who's the optimal patient for this, what are the pre and post procedure care that we have to provide to get the optimal results. We're going to talk all about that today, and so I know it's an exciting topic. Allie, you have performed probably more of these in the practice than any of us, so certainly we're going to lean on you for your kind of like personal experience and expertise in this. And so let's just jump right in and let's talk about the NeoGen. So you started doing this procedure right away, right after you started working with us. Was around the time we got this device. So was this the first device you were trained on?
I think so, because I'm pretty sure I was still kind of working in the hospital a little bit whenever I came in for the training when Angela came down. And so I was really excited about it because I felt the most confident in it because I got the same training as everybody else. So I didn't feel behind anybody. But yeah, it's been really great. I love it as a treatment, like especially when people just like don't know what they want to do. They need to get their skin healthy. Like it's a good for you treatment. Like it's healthy for your skin. It's good for you. You're going to build collagen, all the things. And so I love it as just a baseline for my clients who just don't know what to do, but they want to do something.
Do you want to talk a little bit about the technology and how does it work? Like what is a NeoGen?
Yeah. So a NeoGen, we're bad about referring to it as a laser sometimes because we hold it like a laser, use it like a laser. But it's actually just a heat energy based device. So there's a real nitrogen gas that's connected to it and it creates a plasma heat energy. So you're basically getting boluses of that plasma heat energy down to the layer of the SMAS, which is the muscle layer they lift in a facelift. And so I always explain it to my clients, like, especially females, you burn your wrist on your curling iron or your straightening iron, and that skin, you notice, kind of cinches up there, and it's skin tightening from that burn. And so that's what's happening at a deep dermal level, but also you're getting superficial resurfacing as well. So it's going to clear up, the pigmentation, fine lines, as well as that deep tightening. And so just by sending those boluses of that heat down there, it really helps to just snug up the skin. They call it the non-surgical facelift.
I think it's important when we talk about the plasma device to specify that it's not plasma that we talk about when we talk about PRP, because patients, we commonly get asked that question. So this is an energy-based device, and it's different than PRP, which is an injectable that's derived from the patient's blood. So it is a common misconception because the NeoGen plasma is relatively new, and we're the only office in the area that has it. So I think we're very fortunate to have been able to launch it because it's something that's just a breakthrough in like the development of new skin for our patients.
And it won the 2022 New Aesthetic Device, right, the aesthetic conference last year. So it's super exciting to have it here and to be one of the only practice in the area that offers it.
We were excited because for those of you who have been patients of ours for a while or have known me or Jerry, one of our first devices, we got a pretty aggressive CO2 laser when we were still over in our Mobile office, and this is maybe 11 or 12 years ago that we were in that location. And we had a CO2 laser, and we really kind of got a little bit scared of devices at that point because it had such significant downtime associated with that procedure. So we could have some really impressive results in terms of skin resurfacing. We could really take care of texture and tone and tightening. So a lot of good benefits, but significant downtime. And so patients would need weeks out of the sun after the treatment. Really pretty much they had to stay inside, have this occlusive dressing, which we would use something like a thick Aquaphor for weeks on their face if we were too aggressive with it. And it just didn't fit our patient population. So the downtime was too much for something that people viewed as like a lunchtime procedure. And it required really significant sedation. CO2 has been kind of held up as the gold standard in the aesthetic field for a lot of texture, tone, and tightening devices. So when we first heard about the NeoGen plasma device, I was a little skeptical when I saw the photos and they compared these results to CO2 results. And I can honestly tell you, when I first saw the photos, I actually questioned if they had been photoshopped because I really didn't believe some of the things that I was seeing. And what's been a very pleasant surprise and something that we work with Emergent Medical Technologies, who are the distributor for this device in the U.S. And Angela and Rob are the owners of that company. Really outstanding people to work with. And they're like, we assure you, we're going to stand behind these results. I love the fact now that we get asked if our photos are photoshopped. So that is kind of fun, right? You don't want to be questioned on that, but it's kind of fun to see that we get the same questions that we were asking when we were evaluating the device. So for me, it's been, as a practice owner and an aesthetic provider, one of the purchases in terms of energy-based devices that I'm the most satisfied with.
I think it's one of the devices that it runs nearly every day at the clinic. And it's really difficult to think of a patient that would not benefit in some way from the NeoGen plasma, where other devices that we've had in the past, we had to look for a patient that would benefit from it. Now it'd be easier to find a patient that would not benefit from it. Go ahead.
I was just going to ask Allie, are there any patients that you would say are not candidates for this procedure? Who are the ones that we would say are not candidates for a NeoGen?
I would say anybody who's on like a steroid or anti-inflammatory, hopefully it's like short term or something like that, that will just wait and will postpone the procedure. I wouldn't recommend it for that type of patient or client. With our older clients, I always say like about 65 and up, I recommend that they do a low energy first and then a high energy, kind of to prep the skin. We do have those options available. I think at first when we were just, kind of learning the device and kind of, figuring out how best to either set up a series or is it a one and done treatment, we found that with our older clients, because there is, maybe less collagen readily available, to prep their skin with a low energy, kind of get that collagen stimulated, and then have them come back at that 4 to 6 week period when it's at its peak and do that high energy to make sure we're not just damaging the skin, we're stimulating that collagen.
While we're talking about patients that aren't candidates with a lot of these laser devices, especially the patients that are high on the Fitzpatrick scale. Fitzpatrick scale is the way that we base skin types on color, with Fitzpatrick 1 being a very light complexion all the way up to Fitzpatrick 5 and 6 being someone with a very, very dark complexion. And a lot of times those 4, 5, and 6 patients, they run a risk of scarring, hyperpigmentation. Are these patients eligible for treatment with the NeoGen?
Yeah, so we can do lower energies on some of the higher Fitzpatrick scales, but really anybody who's been, especially like out in the sun or who is more pigmented, there is definitely a risk there. We found that early on, when people came in and they maybe had been out in the sun for the weekend and weren't very careful with their pre-care instructions, and came in and did have a NeoGen done, you do run that risk of hyperpigmenting. And so thankfully it was an easy correction. We can get them back in for other treatments and help to take that pigment out, but that is a risk.
One of the things I really personally love about this device now from all the hundreds of patients that's been treated in our practice. And then, there's another, med spa that has done tons of this up in the Northeast. And when we look at, their results, there really are no long-term adverse events associated with this device. So while we may have some temporary pigment issues such as hypopigmentation while the patient is healing, there's really no long-term adverse events when this is used in the manner that we're trained to use it in. Obviously, any device that's as powerful, we can cause damage if we're not cautious with our use of the device. But I love the fact that it is safe in all Fitzpatrick types 1 through 6. And we can adjust the settings and use this in pretty much all skin types for a variety of indications. What do you think is the most common indication that patients come in to have this treatment? Either of you?
Skin tightening, most commonly. I've actually been doing a lot of acne scarring lately too, though, where people just have those, enlarged pores, those scars on their face that they just can't seem to get rid of. It's a great treatment for that. We've also started our journey, I think, on doing more body treatments with the NeoGen 2, whether it's like a C-section or a tummy tuck scar or something like that, because it is going to stimulate collagen and help with that scar resurfacing. And I'm really excited, to post some more before and afters of those body procedures.
So one of the things I kind of want to elaborate on just a little bit, and you guys jump in here or cut me off if you want to add anything to this, but one of the ways this device works, so we can select a number of energy levels. We can go from something really light, almost like a laser facial or something that an esthetician could perform, all the way up to a deeper depth that's a little bit more aggressive, a little bit more downtime to get more significant results with these one-time treatments. You talked a little bit about doing a series of treatments in our older patient population that we may want to kind of prime or get their skin ready for this. But we haven't touched on some of our younger patients that may have other issues. Maybe they either have just pigment they want to work on or for acne. And for a long time, we didn't have a lot of energy devices that we could use just on a variety of conditions. And so we had one device that was good for one condition, and we needed multiple other devices if we wanted to do other things like skin tightening. But this device is also really effective for treating acne. So when we look at the plasma energy and its effect on bacteria on the skin, and we can measure this through our digital imaging devices and look at porphyrins or the amount of bacteria, we see that it is decreased significantly after one of the NeoGen treatment. So we haven't seen a lot of those patients yet, and hopefully we're going to have more of that coming in because we're able to show how we can really impact that bacteria on the skin. Have you treated any acne patients with it, Jerry?
I have, and I do a fair amount of just spot treatments with acne as well. It's been a great tool for us to use. We have a couple of other devices that we've had in the past that work really well also, but I don't think anything's quite dried it up like the NeoGen has. The nice thing is that like you mentioned, you can do it from nearly a spa setting all the way up to something that's very aggressive. So a lot of these acne prone patients are younger patients and they don't want the downtime that's associated with something strong. They can leave the office with just even a mild redness, but they get some clearing from the treatment itself. So I think that when people know that the device is out there, they know that the device is safe, that it'll be something that's really popular in that population, because acne's a battle. We talked about it on one of the previous episodes that, it was a huge battle for me and kind of started me in this whole skincare journey that I've been in for years now. Man, it takes a toll on you,
Mm-hmm. Allie, do you want to, can you just let our providers out there listening and the other listeners know what is a typical treatment with a NeoGen look like when they come into the practice that day they're going to get it, kind of the process we go through to treat them?
Yeah, that's one of my biggest questions, especially from clients and for other providers too. It's a relatively quick procedure. The biggest part of it, I think, is like taking our before and after photos. We have a machine that we're able to do a skin analysis with, which is able to assign a numerical age to 8 different qualities of your skin that makes up your skin age. So we always do that. We numb our clients, obviously, prior to the treatment because it is hot. But most people tolerate it very comfortably. Once, they have the numbing cream, we also offer a Pronox for them to have during the procedure, which kind of just helps to take any anxieties away. While the numbing cream sits, we also place a moisturizing mask on the client. This device actually travels best through moisturized skin, which is a contrast to most lasers. Most lasers, you'll prep with an alcohol wipe to get any of that oil and moisture out of the skin, but you do want the skin moisturized for this procedure. So we'll let that sit for about 15 minutes. We take all of that off and then we get started. Usually a full face can take about 20, 25 minutes total treatment time, depending on if my client needs breaks or anything like that. But most people tolerate it just fine, and it's a relatively quick procedure. We'll put some elastin skin nectar is my choice of what to put on directly after, because it's sensitive enough that it won't hurt the skin. And it's not ablative, but it's pretty close.
Talk a little also about the time from the patient's initial consult, some things that you recommend for them between that initial consult and the day of their treatment. You mentioned a little bit about patients that had sun exposure. There's spray tans that come into play. There's the peptides that increase the melanocyte production. And so mention some of that. Is there anything that they need to stop prior to coming in for treatment? Anything they need to start to prep their skin?
Yeah, so we always recommend, you shouldn't have a high amount of sun exposure. So in the summertime, if you're a sun goddess, wear your sunscreen, wear a hat, try to stay out of the sun as much as you can. We also say, if you're on a retin-A or something that's drying for the skin, I just mentioned, it travels best through moisturized skin. And so we ask them to stop that. If it is somebody who has a lot of pigment, and then we can also prescribe them a hydroquinone to help them pull some of that pigment out before the treatment. And we'll usually put them on that for about 2 weeks before we do the procedure, and then just staying hydrated. We offer IV therapy at Skin and Tonic. Some people will come and get one of those, the week of the procedure. You can get one during your procedure, and just being mindful of staying hydrated, not exfoliating your skin or doing anything drying to your skin.
And people also talk about, can you do this during the summer? I think any of our treatments can be done, year round. You just have to be aware of post-care. And so that post-care treatment, post-care sun exposure, we encourage everyone to be very mindful of it, regardless of whether you're having a treatment with a plasma device or any of our other energy devices. But so it can be done year round.
Yeah, so I want to talk a little bit about one of our complications, and this was early on, probably within the first 10 patients that we treated in the office, and I find it really interesting, and I actually show the photo a lot when I'm teaching, and I think people wonder, because we're used to seeing the best before and after, so practices usually only showcase their best work. They don't like to show any of the kind of bumps that we have along the way or adverse events. And we've all had them. If you do enough of these things, you're going to learn from your mistakes. You're going to do better with your future treatment. So one of the things that we had early on that's in contrast to a lot of the other lasers, we had a patient that we treated and we really pulled a lot of pigment out of the face, which is exactly what this is designed
in certain areas
to do. In certain areas. So she was striped.
She looked like a striped bass. That's the picture she sent me. She's one of our very favorite patients, and has been for a long time. But she was patient with us and patient with the treatments and the process, and so.
Yeah. So the interesting thing about that, and the reason I like to show it so much, is because I think it demonstrates how powerful and effective the device is. Because if we look at that photo, I think most people assume that the stripes are a post-inflammatory hyperpigmentation. They think the stripes are where pigment was as a result of too aggressive treatment. When in fact, when we review it, the stripes are areas that we missed, that we didn't cover thoroughly with the NeoGen device. So it actually made the skin a nice tone around that. But where she had been, had maybe some sun exposure, been on melanotan, and had some additional pigment in her skin, you can see exactly where we missed those paths. So we've adjusted our treatment patterns a little bit to make sure that we have thorough coverage of those areas, and we were able to treat her after that and make it really nice and even. She probably has had one of the better results now of everybody.
Because now her skin's tighter than all of ours. hours.
How many NeoGens did she have to get there? Yeah, she
Looks phenomenal, and you can see some. I think I have a picture of her on my social media, so you can go on our social media. There may be one on Skin and Tonics as well.
Yeah, if not, we'll put that up. We'll put some photos up for you guys to see of this, but it's a really effective treatment. So I also like to bring out that, we all learn as we go. So for the new providers, new injectors out there that may be tuning in and listening, don't let fear of complications hinder you from proceeding or introducing new therapies into your practice, because you really can bring in a lot of new technology and get phenomenal results with your patients. But you're going to have to make sure that you get proper education on that and know how to handle the complications when they occur. Now, I know we're getting close on time. Let me just hear what final words you have on NeoGen.
Just to kind of touch on the healing process, because I'm not sure that we mentioned that yet. You do have about 5 to 7 days of social downtime. So you feel fine. It feels like a sunburn whenever you get finished. You feel like you have a sunburn for a day. Honestly, the next day, other than your skin feeling tight, which is nice, you don't feel bad at all. There's no pain afterwards. It's just, your skin does get dry. It does have some like flaking, not like a chemical peel, but just a little bit of flakiness. And then after that skin flakes off, your skin the texture's great. It's smooth, it's even. And then you'll see the collagen stimulation results, 4 to 6 weeks later, and the results will last you for about 2 years. And it can be a one and done treatment. That's the great thing about it.
And it continues to improve over 90 days. So it's one of those things. It's almost like looking in the mirror every day. You can see a little improvement. So it's a great treatment. It's an easy treatment, and for the result, it's just amazing.
Yeah, I think so too. I'm really glad that we've added this to our practice. Like I was saying earlier, it's something where if you're like, I don't know what I need done, but I want something done, I think it's a great starting point just to get your skin healthy, get it ready, get it tight. Get it right, get it tight.
Have you had the procedure?
Yes, I have.
Okay, I know.
I've had it done. I think have we all had it? I think we've all had it done now.
I for sure have had it done.
I've had it done.
Jerry's had it done twice now, and so I love the results. And for me, it's really the only device we have without using some sort of intraocular, like a metal shield or something. With this device, we don't have to use it. We can go directly on top of the eyelids for eyelid tightening. And I kind of struggle with that. And so it's like, do I need surgery to tighten them up a little bit, or can we use it? And this is a device that I had a great result from just having it. And actually, you did my second treatment just on my lids only, and I've loved the results. So I do like the fact that we can treat directly up to the lash line with this, tighten up the lids with it. So
and all the way underneath too, so that tear trough hollowness can be helped a lot with it too. So I think that's a big differentiator between this and a laser, a light device where you have to wear goggles to protect your eyes. So yeah, I love it. It's so great.
All right, great. Any final words, Jerry?
I'm good.
You're good. All right. Well, thank you guys all for joining us for another episode of Beauty and the Brain. We hope you have learned a lot about the NeoGen PSR today. Don't forget, submit your questions and ideas for future topics through our website or through our social media. We really want this podcast to be responsive to the questions that you have about what's going on in aesthetics. See you soon.